Why should health insurance be linked to our employers? I spent most of my career working with employees of very large companies. Some of them or their family members became diabetic, one had a child with serious, permanent birth defects, others developed heart disease or other lifelong ailments. These people could not resign to look for a better opportunity, because they would lose their health insurance and be bankrupt in about 5 minutes trying to pay for their own or their family's astonishing medical expenses. COBRA benefits are very expensive and last 18 months. They lived in constant fear of a layoff or losing their job for any reason. My skeptical mind wonders whether big employers use employer-paid or subsidized health insurance as employee retention tools. How severe that might be depends on the ethics of the company leaders and the existence of varying state laws restricting such practices. In the USA, group health plans were first offered as a way to avoid wage controls. Even today, insurance premiums for both the employer and the employee are tax-deductible if provided by your employer, but not if you pay for it yourself depending on your income tax situation. Tax-advantaged treatment of employer-provided health benefits has defined this market and made it standard. Due primarily to the PPACA, the market is in flux and this is changing, but not yet changed. The employer is necessary because employees are not capable of navigating the complex decisions necessary to select a health plan which will best protect them. It is apparent that employers of all varieties, whether they make steel plates or run hotels, are smarter than their employees. Which is the exact reason they run the business or own it and do not work at it. Therefore, having the smart people select the doctors, plan design, out-of-pocket, and affordable premium is better than having those without the skills necessary select the benefits. Absolutely not. I am in Ontario and we have a single payer. As a former employer, I don't want to manage employee healthcare. I want to manage the business. As a former employee, I don't want to involve my employer in my healthcare care. The single payer does a much better job. When I dealt with my American associates, I felt sorry for them. One guy had a little daughter who needs serious and very expensive heart surgery. He had to pay 25%. But even that amount was out of reach for him. I don't know what ever happened to him. When I worked for a large multinational, we had a drug plan. One discussion at the Executive Council was whether Viagra should be on the list of drugs that the company paid for. It was an interesting conversation. No companies need to manage their business like getting more sales, better quality, etc.